The number of reported cases of COVID-19 in the country appears to be spreading to rural counties. Among the 11 new cases reported Monday, only 2 are from Nairobi County.
In the last 24 hours, we have tested 674 samples. Out of these samples, 11 have tested positive for coronavirus disease. And so we have now passed the 200 mark. Our figure stands at 208.
Mandera County produced the highest number of new cases at 4, Mombasa 3, Nairobi 2, with Nakuru and Machakos registering a case each. Kenya now has 9 deaths after 1 more patient succumbed to the disease in Nairobi in the last 24 hours, with 142 active patients, 2 in critical condition.
All the 11 are Kenyans. 4 have a history of travel from the United Arab Emirates. 6 are male, while 5 are female, aged between 1 year and 42 years.
Health Cabinet Secretary Mutahi Kagwe saying Kenya can turn around the situation within a short time if citizens strictly adhere to set guidelines.
We're working hard as a ministry to make sure that we have sufficient capacity in terms of internet so that people can be able to have the connectivity and video conferencing facilities that exist.
Where we are having a lot of challenge in terms of behavior change, in terms of the call for social distance, is still in the counties, especially the rural counties.
A total of 2,306 contacts had been monitored by Monday, out of which 1,687 have been discharged, with 619 contacts still being followed.
We have had a few cases of people with special needs, like breastfeeding mothers, people with physical disability. And of course, we have taken good care of them like the rest of the other people.
On the issue of barring COVID-19 patients, Kagwe said it was high time Kenyans prepare to the fact that COVID-19 bodies will be disposed in a manner that is not aligned to their cultural beliefs.
I therefore want our people to be mentally prepared and to accept that COVID-19 victim bodies shall be disposed in a manner that protects the living from infections and in accordance with the Ministry of Health burial protocols.
Meanwhile, Education Cabinet Secretary Professor George Magoha says parents with students in private schools will have to pay for the online teaching, downplaying fears of interruption of school calendar, saying the main concern of the government at the moment is safety of its citizens.
I have certain scenarios which I shall not divulge to you at this time, because those scenarios also depend on how we are seeing my brother Kagwe proceeding with the coronavirus. We are not going to risk the lives of our children because dead people do not take exams.
According to the Ministry of Health, the number of infections in the country are set to be lower than the projected modeling of 10,000 by the end of this month, thanks to Kenyans who have opted to adhere to set guidelines of COVID-19 prevention. Purity Museo, Channel 1 News, Nairobi.